Have you ever felt like you have tight hamstrings or tight quads? Chances are if you're watching this or you follow anything that we put out, the answer is yes. I'm Dr. Gene Chirakabrad.
I'm Dr. Ryan Smith.
And today we're going to look at, do you really have tight hamstrings and tight quads? Chances are, it might be something else. Let's start with the hamstrings. So let's have Ryan stand up. Quick test that pretty much everybody does is bending down, trying to touch your toes, right? You go down, you go, oh man, usually one side versus the other feels tighter. Now, granted, this is a pretty terrible way to test your hamstrings, but for the sake of this, let's just go with that. So if one of your hamstrings feels tighter than the other, that should be the first question you ask is why one side versus the other? And usually that puts us down the path of this is probably not pure tightness. This is coming from your low back. This is related to your nerves, or what we like to call neural tension, meaning it involves your low back, but also the entire spinal cord, because the entire spinal cord is wrapped in this sheath, this really, really tight structure that connects all the way up from the head down to the pelvis. Here's how we test this. Let's say his left hamstring back here was super tight. So we're gonna have Ryan slump down into this really, really bad posture, head down, back curved. This puts this entire spinal cord into a tension position. Then he's gonna straighten out that same hamstring that was really tight. And if he feels sensation down the back of his leg that isn't tightness anymore, that feels kind of like nerve sensation, then we know that is probably what's causing it. And here's how we address it. So Ryan is gonna bend his ankle up. So this puts max tension on that entire system. Then he's gonna lift his head up, and that relieves some of that tension because his head comes up and it brings that stretch off that entire spinal cord. Follow along here, okay? This is more tension because everything is rounded and pulled. This is less tension. Now, if you do it several times, that works the entire system back and forth. Then he stops, puts the leg down. Ryan's gonna stand up, and he's gonna bend forward again, and voila. Full range of motion, no tightness, feels better. Question answered. Was it tightness? No. There was the sensation of tightness, but there was not actual shortening of the muscles. That is one way to differentiate hamstring tightness versus involvement from the nervous system. Let's take a look at the quads. Take us through it.
All right, so let's talk about the quadriceps now, or the quad, the front of the leg. Oftentimes people can feel a lot of tightness in their quads or a lot of pressure kind of near towards their kneecap. Oftentimes what people think is a tight quad or a muscle can often be similar to what we just saw with the hamstring. It can actually be coming from the nervous system and the neural tension coming from the spinal cord. So now the way we test this and look at it and help relieve some of that tightness is going to be in this position. So Gene's going to lay flat here to begin with, and then he's going to press up onto his hands. When he does that, he's also going to look to the ceiling. So this is putting the front side of him on as much tension as it can. From here, I'm going to ask him to take his right heel, move it towards his butt. As he does that, you see how far he can get, and he lowers it back down, and he goes through that motion repeatedly, keeping his head up, looking towards the ceiling, bringing his right heel to his butt, and going back and forth. So we're taking that femoral nerve, which is what supplies the quads, and putting it on and off tension to help alleviate some of that pressure or tightness that he may feel. So after he does this, he relaxes back down, he walks around a little bit, gets a feeling for what his quads feel like, and that will determine whether or not the tightness came from a true muscle or from the actual nerve and nervous system itself.